This video is to help you maintain and improve your diabetes control. We will be looking at the importance of correct injection technique and site rotation. The recommended areas to use for an injection site are stomach, upper outer arms, outer thigh and buttocks. It is recommended that you check your injection sites every time you inject. If you inject within the same area all the time, this area of skin may become damaged. If this happens, your insulin or GLP-1 may not be absorbed well and may cause your diabetes to be poorly controlled. To check your own injection sites, stand in a well-lit area and look for any signs of change to the skin, for example, lumps, hardened skin, or if the skin has a shiny appearance. Someone else may be able to support you with this if your vision is poor or if you're unable to examine the injection sites yourself. Examine the area with your fingertips, moving in a circular motion around the area. If there is an outer area of a lump or hardened area, take a note of the size of the area and avoid injections here for approximately 3 to 6 months. Lipos is short for lipohypertrophy, which means thickened and possibly hardened area of fatty tissue that develops in the layer of skin where injections of insulin or GLP-1 are given. This is called subcutaneous skin. Lipos can possibly be caused by reusing needles. It is important to change the needle after every injection. Injection sites are not being rotated, moving of areas, injecting into an already hardened injection area. If someone needs to support you with your injections for insulin or GLP-1 and a safety pen needle needs to be attached or taken off, it is recommended that they use a safety injection needle. Please contact your practice nurse, diabetes specialist nurse or GP to support you with this. The needle size that is currently recommended is 4mm, 5mm and 6mm pen needles. Please note, if you are using a needle longer than this, for example 12mm, please contact your practice nurse or GP as these may cause hypos, low blood glucose levels. If a pre-mixed insulin is being used, yes, it is advisable to mix this to make sure both insulins are mixed together in order to maintain good blood glucose control. You may risk having possible poor diabetes control with raised blood glucose levels as the lipos areas are damaged skin and therefore may reduce the absorption of insulin or GLP-1. You may risk having low blood glucose levels called a hypo due to improved insulin absorption in a fresh site. You may need to reduce your insulin dose when you change to a fresh area and monitor your blood glucose closely. Contact your practice nurse or GP, diabetes specialist nurse if you need advice. When you have injected your insulin or GLP-1, it is advised that you leave the pen needle within the skin for a count of 10 seconds before you remove it. This allows the liquid to be absorbed correctly. To remove an insulin pen needle, lay the injection pen down on the table and move the used needle into the lid. When fully enclosed in the lid, then secure the needle within the lid and unscrew needle and place in a yellow sharps box. It is recommended that you always use a yellow sharps box for the disposal of pen needles. These are available from your surgery on prescription.